is recommended for patients with trauma unless they meet all of the following criteria. Absence of cervical spine tenderness, no evidence of intoxication, a normal level of alertness and consciousness, absence of focal neurological deficit, and absence of any distracting injuries. And then the Canadian cervical spine rule is it's an algorithm actually. And
it's in that packet going around.
is it?
Yeah.
Okay, well good. You guys can go ahead. And there's just basic questions. Is there a high risk?
Tim, do you want
Is
to
it-
Google
and
that
it's
and see if you can bring it
age,
up?
mechanism of injury,
The Canadian.
neurological deficit, and then yes, you do
Trying to think off the top of my head
X-rays
what
or
it's saying.
CT. No, you go on to the next, and it's an algorithm. So
Hannah, can you repeat what that algorithm is, and we can try and Google it up here? It's the
It's
Canadian.
that right there.
it's the
This one has the Canadian C-spine rule. Is that
Canadian
yeah,
C-spine
yep,
rule. There you are.
that's it right there.
That other packet that you guys have that's like 4 pages long, is that the Canadian right there?
2 pages.
Yeah, then there's another one that's 4 pages long that I passed around. That one's Dane County EMS in the southern part of the state. That's their protocol for C-spine.
And then I found another article, and the title of the article is "Research Suggests Time for Change in Pre-Hospital Spinal Immobilization." And this is pretty much, looking at it, it looks like a persuasion article as to why selective spinal immobilization would be good. And there's just some things that I highlighted in here. Increases patient anxiety, may aggravate underlying injuries, increases the risk of aspiration if they vomit. And again, draining the airway, control of that is questionable. Spinal immobilization results in 15 to 20% reduction in respiratory capacity. Obese patients, elderly patients, and patients with underlying diseases such as CHF, COPD, and asthma. Studies have shown limited or no benefit of immobilization of penetrating trauma. The longer a patient is immobilized, the more likely pressure ulcers will develop, most notably in the occipital, sacral, or heel areas, and this is especially true in the elderly, so we've never mentioned that before. Independent studies show that whether the penetrating trauma to the head, to the neck, or torso, immobilization is unnecessary, interferes with, and delays emergent care that should be seriously reconsidered as a standard of care. A Journal of Trauma article concluded indirect spinal injury does not occur in patients with gunshot wounds to the head. Protocols mandating surgical spinal mobilization after a gunshot wound to the head are unnecessary and may complicate airway management.